Thanks and good evening and welcome to this webinar about specialty medicine recruitment. My name is Jeff Smith. I'm the Regional Postgraduate Dean for the South West and also the Lead Dean for Recruitment. I'm going to be joined tonight by Claire Wright, who's the National Specialty Recruitment Manager, and Jonathan Howes, who's the Deputy Director for National Recruitment. Many of you have submitted questions in advance and we'll answer as many of these questions as we can as we go through today. Just a couple of pointers though. This webinar is about recruitment for 2022. And so if you want to ask questions about other stuff around training, then we're not going to be able to answer them today. We can always set up further webinars for other subjects. And so if you do think we need to be doing further webinars, let us know because we can get colleagues to put those on for you. The other thing is what we're not going to be able to do is answer personal questions and queries. We will try and answer broadly to cover your questions where we can. And I'd also add that it's going to be very difficult for us to answer all of the specialty specific recruitment questions, just given the sheer number of specialties that are recruited for each year. The webinar is recorded, so if you can't join live or your colleagues can't, we will put a link out to watch the recording and we'll also put that link onto the specialty recruitment website. You can ask questions throughout the webinar. You can do this through the chat function and we'll get through as many as we can, either directly back through the chat or in the Q&A session at the end. We are going to limit the webinar to an hour, so if there's lots of questions, we will endeavour to answer these offline and provide the answers on the Specialty Recruitment website. So without further ado, I'm going to introduce Claire Wright, who, as I said, is our National Specialty Recruitment Manager, who's going to carry on with her presentation. Thanks, Claire.
Thanks, Jeff. Right, can everyone see my screen? I'm hoping you can. I'm getting nods, so I'm hoping it's up. So the presentation tonight is around specialty recruitment for 2022. So I think that's one of the questions that have already been asked. So these are proposed starting in August 2022. I thought I'd start by just giving you an idea of the scale of recruitment. So in terms of applications that we receive, I've given you a table there which has everything from August 2015 all the way up to August 2021 recruitment, which we just completed. And you can see that there's been a vast increase in application numbers over the last couple of years, while post numbers have remained fairly stable. Now, it's worth mentioning that the increase in application numbers has coincided with changes to immigration regulations. So in October 2019, there was a change to the shortage occupation list, which meant that all medical practitioners could enter recruitment without having to satisfy the resident labour market test, which meant they were considered alongside UK graduates and those other people with right of residence. So whilst this meant that they were considered at the same time, it's unfortunately something that we have no control over because they are immigration regulations and we have to adhere to those. In terms of applicant behaviour, I thought it was worth mentioning how people tend to apply. So the vast majority of applicants only submit one application per year. So on the table that you can see in front of you, or the graph, you can see the big blue bars are people that only made one application in round 1 and round 2 of 2021. Now, whilst this might show real commitment to a specialty, it's just worth remembering that it also limits your opportunity, because if you're not successful in that specialty, by the time the next recruitment round comes, there will be less posts for you to apply for and less opportunity. And in fact, in 2021, because we managed to fill all of the posts for the first time ever in round 1, there wasn't a re-advertised round of CT1 and ST1 specialties. So it is worth considering that when making your application. You can apply to multiple specialties and you do have the option to hold offers until a certain date to allow you to hear back from the other specialties you've applied for. So by only making one application, or you are limiting yourself by applying to many, you still have the opportunity to wait for the outcome of your preferred specialty. You'll see that there are always some people who make multiple applications, and what I would caution against here is that, you know, when you get to interview and you're questioned on commitment to specialty, you might struggle to demonstrate that if you've made 25 different applications to different specialties. So it's just worth keeping the balance right, I think. So in terms of what we're going to do for 2022 recruitment, we have engaged widely with people who have taken part in recruitment this year, so assessors, also applicants, the recruitment officers themselves, and also the Royal Colleges, to understand how recruitment has gone and what people want it to look like in the future. And based on that feedback, we've come up with a number of principles for specialty recruitment that we will be following, or all specialties will have to follow for 2022. So the first of that is that you as the applicants will know what the specialty process is before you apply. So all plans have been developed with the anticipation of further COVID disruption, but also service pressures as we go through the recovery post-COVID. And in case there are any social distancing or restrictions in place that mean that face-to-face interviews couldn't happen. So we've put that in place so we know exactly what's going to happen. The plans are all deliverable. Where application numbers exceed interview capacity, shortlisting processes may be adopted. And certainly with the increase in applications over the last couple of years, specialties that have previously never had to shortlist have had to adopt shortlisting. So it's worth remembering that that does take place and what the requirements of that are. If you're applying to a specialty where self-assessment is used, so self-assessment is the process by which you score yourself in an application form based on your experience and your achievements. If your specialty uses that process, then you will have to submit evidence that's verified at a later date and to justify the score that you've given yourself. There won't be any face-to-face in-person interviews during the whole of the 2022 selection process. So any interview that you have will be virtually, and that could either be via MS Teams or an alternative online platform, which we are in the process of looking at procuring. Interviews will be undertaken digitally as a single panel. If we do manage to get a system that allows that to have multi-panel interviews, then we will have multi-mini interviews in a digital environment, but again, there won't be anything done face-to-face. Last year, we took a decision to remove named courses from person specs because we were worried that people would be disadvantaged either because the courses weren't available or where courses were being run again, that there were huge waiting lists and that you wouldn't be able to get them. So what we don't want to do is disadvantage people needing to get courses that they can't get and then are therefore missing out on certain scores. So they won't be reintroduced in 2022. What we'll replace those with is a statement that says demonstration of skills and competencies rather than the requirement for an actual course. And one of our big aims is that no group of applicants will be disadvantaged. Now, there may be individuals who feel that they're disadvantaged by the decisions that we've made, either because they would rather have a face-to-face interview or other reasons. However, in terms of groups, we will not disadvantage any groups through the process that we adopt. So in terms of recruitment plans, each specialty has been asked to submit their recruitment plan for 2022 recruitment, and those have been reviewed by a 4-nation group called the MDRS, Medical Dental Recruitment Selection Recruitment Group, and we have fed back to those specialties as to whether or not those plans have been approved. Some of them are still undergoing alterations or amendments, but we will be in a position to publish those on the specialty training website in a couple of weeks' time, which means that everything that specialties are doing you will know about well in advance of recruitment opening in November. There's been some questions prior to the webinar about post numbers, so I put a slide up earlier with post numbers over the years, and there are no plans to reduce post numbers in 2022 based on COVID-19. As I said, numbers have been stable year on year, and if anything, numbers are likely to increase in certain specialties due to wider workforce plans. Each specialty has a lead recruiter who is responsible for the recruitment to that specialty, and that's an HEE local office who will recruit to all posts in all of the participating nations. The applications are made through the lead recruiter, so they advertise on the Oriel system, and you will make your application to that recruitment office regardless of what region you want to work in. So for example, London are the lead recruiter for clinical radiology. If you wanted to work in clinical radiology in Yorkshire, you would still apply through the London vacancy. So it's important that you know who the lead recruiter is for the specialty that you're applying for. Lead recruiter details can be found on the Oriel website under the recruitment leads page, and I have put the link here. And lead recruiters will be able to answer all the specific questions that we can't answer today about the individual processes. So in terms of when their specific guidance will be released, post numbers, all that kind of thing, and how you apply for them. So the timeline for 2022, based on the traditional timeline that we used pre-COVID, we have extended the round 1 timeline slightly, so it's in line with what we did in 2021, and we've brought the round 2 application window forward to November, same as we did last year. Now round 2 is the ST3, ST4 recruitment in uncoupled specialties. The reason we've done that is that digital selection processes generally take longer to deliver than face-to-face recruitment, where we can sort of bundle 200 people into a football stadium in a day. And what we don't want to do is to reduce the number of people being interviewed due to time constraints. So we've extended the interview window to allow us to interview as many people as we possibly can. In terms of when recruitment opens, so round 1, which is the ST1, CT1 specialties and run through. So you might see the odd ST3 specialty in there for specialists that have a run through programme. Opens on the 2nd of November. Adverts appear on the 2nd of November and it opens for applications on the 4th, closing on the 1st of December. Interviews will take place between the 4th of January and the 18th of March, and all specialties in that round will have had to have made their offers by Thursday the 24th of March at the latest. That doesn't mean that that's the date that all offers will go out on. That's the absolute latest that any specialty in that round needs to make their first lot of offers. So if recruitment for a particular specialty has finished before that date, offers will be released before then, but specialties will be able to advise exactly on when their offers are going out, and that's information you should expect to receive if you apply to a specialty. In terms of round 2, which is the ST3 and ST4 specialties in uncoupled programmes, the adverts will appear on the 16th of November, with applications opening from the 18th of November to the 9th of December. Again, interviews will run from the 4th of January through to the 14th of April for these specialties, with offers being released no later than the 21st of April. Again, if a specialty has completed their recruitment before that date, there's nothing to stop them offering their posts earlier. So in terms of making your application, it's really important that obviously your first decision is what specialties you wish to apply for. We do have competition ratios from previous recruitment rounds available on our website, and it's worth having a look at those just to get an idea of how competitive specialties are. Obviously, it won't give you an idea of what's going to happen this year, but it can give you an idea based on previous years, and certainly with the increase in numbers, it's worth looking at what the competition ratios have been in the last couple of years. You can apply to as many specialties as you like, subject to eligibility. And it's worth looking at the person specifications. Again, they're available on the specialty training website because they will show you all the requirements that you need to meet in order to apply for specialty training. It's really important that you read all of the supporting information before you start your application. So as well as the generic applicant guide that we publish on our website, each of the individual specialties will generally publish their own specific guidance for their programme as well. And it's worth reading that and understanding both what the timelines are, what's expected of you, and if there's anything that you need to upload with your application form. And all applications are made through Oriel, which we've been using for a number of years, and the link is there, but I'm sure many of you are already familiar with Oriel, particularly if you're in the training programme. It's really important that you pay attention to the requirements of the person specification, because the first stage of recruitment is a long listing process which looks at the essential requirements, and if you don't meet those, then your application will be rejected and won't progress any further. So it's really important that you have a look at the person spec. Allow yourself plenty of time to complete the application and familiarise yourself with the deadline. Every year we see approximately 60% of applications made in the last 72 hours of any recruitment window. Now, when you look at the numbers, and we get probably, I think in round 1 we get around about 20,000 applications. So 60% of that in the last 72 hours is a lot, and we often get applicants complaining about performance of the system. But obviously, with the load that's on it, it's always going to be an issue. So please don't leave your application to the last minute. It does take time to complete. There is a 3-week window by which you can apply. So the best thing you can do is start early, get it in early, and avoid any problems. If you're applying to a specialty that has self-assessment, make sure you select the appropriate option that's relevant to the experience you have, but also that you have evidence to support. So if you don't have any documentary evidence that you can upload to support a certain score, you need to consider what score you should be choosing, because you will be downgraded on that when your evidence is verified. Ensure you submit everything you need to at the time of application. So if you're applying through a CREST route, make sure that your CREST is uploaded to your application form. If you've completed foundation previously, for example, make sure you upload your FACD. All of that information is available about what you need to do at the time of application, so it's really important you familiarise yourself with that. Double check your application form before you submit it, because once you've submitted it, there is no going back. You can't change anything at a later date. Even if you realise that you've made a mistake and contact the recruitment office, there is no mechanism to make any changes. And the final thing is ensure that you access your Oriel account regularly throughout the entire selection process. All communications with you about your application will be made through Oriel, while an email will be sent to you as well. Because that's going external to the Oriel system, we have no control over any firewalls that you have set up on your own computer or your own inbox. So we cannot guarantee that an email can get to you. However, we can guarantee that the messages within the Oriel message centre will reach you and your account. So it's really important that you log in regularly throughout the process, because a lot of activities are time-based and there won't be any extensions to the times that you're given to respond to things. Okay, I'm just going to move on now to talk about a couple of specifics of the selection process, which obviously do impact on a number of specialties. So one is the use of the MSRI. So this is a computer-based test that has two components: professional dilemmas and clinical problem solving, and it's used by a number of specialties at CT1 and ST1 level. In general practice and core psychiatry, the entire appointment process is based solely on the MSRI, so there is no interview. Selection is based solely on your score and then your rank based on that score. It's also used by a number of other specialties to contribute towards the final selection, and there's a list of specialties that use the MSRI on the specialty training website. It's been shown to be a reliable and valid tool, hence the use by many specialties and the increased use over the years. It's also really flexible, which means that we can use it in different ways in different specialties. So some will use it solely as a shortlisting tool to get you to interview, others will use it as part of the final selection process. As I say, there are two specialties that use it as their sole process. I've mentioned self-assessment quite a lot throughout this talk, and I just wanted to mention something about verification. So if you're applying for a specialty that has self-assessment as part of the application process, your score will need to be verified, and it'll be verified based against evidence that you upload. So we have a self-assessment portal that we use for that purpose. Once the application window is closed, you will be sent login details to get onto the self-assessment portal, together with guidance on how to upload your evidence. There'll be a deadline by which you have to submit your evidence, and you'll be asked to tag it based on certain domains. So when you look at a self-assessment scoring framework, it'll have different questions, so maybe presentation and publications, teaching experience in the specialty, that kind of thing. Each of those domains will have a question number assigned to them, which is the tag. And when you upload evidence into the portal, you need to make sure that you tag it to the correct domain so that it's assessed by the assessors against the right domain and the right scoring framework. After the deadline is passed, assessors will be given access to the evidence that you've uploaded to score that. And based on the framework and the evidence that you've put in there, they can either give you the same score as you've given yourself, they could increase your score, or they could decrease it. So it's really important, as I said earlier, that you look at the option and make sure you have the appropriate evidence to upload against that domain. If you're not happy about the process, you can make an appeal to have it reviewed again, but you'd have to say what domain it is and why you felt you wanted it reviewed, but you wouldn't have the option to submit further evidence. So it's important you get it right first time. If you're successful in the process and you get made an offer, your offer will be made through Oriel. So everything happens through there. And it'll be based on your selection rank, so based on your score, and also the geographical preferences that you've stated in your application form. You will never be offered a post for a preference that you haven't ranked. So if you say that you don't want to work in a particular area in your preferences, you will never get an offer for that particular area, even if it means that somebody lower ranked than you gets an offer and you don't. When you get an offer, you have 40 hours to respond, and you have the option to accept, decline, or up until the hold deadline, you have an option to hold. So where I mentioned earlier about multiple applications, the hold option allows you to sort of really wait to see the outcome of further offers. So if it's not your preferred specialty, you can hold that offer while you wait to hear, but you can only ever hold one offer at one time. If you try to hold a second offer, the first one will get declined by the system. So make sure that you are holding the preferred one that you want. Once you accept a post, you won't get any further offers in that recruitment round. So it's really important that if you are accepting, that you really do want to take that post. And if you decline a post in a particular specialty, you won't get any more offers from that specialty. However, you will continue to receive offers from anything else you've applied for in that recruitment round, and you can upgrade your offers. So if you get your preferred specialty but not your preferred location, if your preferred location becomes available at a later time, you could be upgraded into that without any further contact with you if you've opted into that. And then just finally, just where you can get some further information. So I've mentioned the specialty training website a lot. We have a lot of information on there, from person specs, competition ratios, the individual recruitment plans, and also the applicant guidance. But also you'll get information from the individual specialty specific website. So each specialty generally has their own website of information. And the Royal Colleges also will put out some information that you would find useful through the recruitment process. And I think you'll be pleased to hear that's me finished talking now. I think I'm handing back to Jeff, am I?
Thanks, Claire. You say you've finished talking. I'm sure you'll be picking up some of the questions. Before I start picking up individual questions, there's a couple of themes that have come through in your questions, which I'll pick up on. The first one is around impact of COVID and how we're allowing for that. Pretty much ever since COVID hit, we've been aware that it has impacted on candidates' ability to sit specialty examinations, to access specific courses, and in some cases access specific elements of training. And so what we've ensured throughout is that the personal specifications and also the scoring systems for recruitment have taken that into account. So as an example, we've not allowed something to be a requirement in a personal specification for a specialty if it would disadvantage people purely because of COVID, and that's been a principle that we've used throughout. Claire has picked up on, in her presentation, on self-assessment form scoring. We have said that we will insist on verification of scores, especially of scores around the boundary of success, in order to ensure that you're being scored fairly. And that's something that our training representatives have been very, very keen on. And there was a question about disadvantage of changing specialty. And I would add to that disadvantage if you apply for multiple specialties. And the quick answer is no, there's no disadvantage to changing specialty or making multiple applications. But I'd encourage you to make sure that you've carefully read the personal specification for each specialty you apply for to make sure that you meet it, especially if you're changing from one specialty route to another. And also think very carefully about how you're going to evidence the fact that you're really interested in that new specialty you're applying to, as recruitment teams put a lot of emphasis on how keen you are to be in that specialty. So make sure that you've thought about that as you put your applications in. So I'm now going to move on into the questions that are coming in fairly rapidly. Specialties that will use MSRA, Claire's touched on this already. We will come up with the specialty specific detail prior to the recruitment rounds opening. So Claire, do you want to just reiterate the specialties that will be using MSRA for us?
Yeah, so all of the specialties that used it in 2021 will continue to use it in 2022. There is one specialty that we're just still in negotiation with, but we will have the final list within the next week to 10 days. So as soon as we have that final list, we'll publish it on the website. But the vast majority who used it in 2021 will continue to do so.
Thanks, Claire. There's a question about non-traditional pathways such as public health. I don't particularly want to go into specialty specific discussions about this, partly because the team here don't have at their fingertips the routes for all 60-something specialties that we recruit to. And so we don't want to get that wrong, but what we can do is point you to the appropriate lead recruiters for each specialty who will be able to answer that. CAST scores as part of psychiatry ST4 applications. Claire's nodding at me, so I'm guessing the answer to that is, without having to get Claire back on the screen, that CAST scores are going to be part of ST4 applications. We're getting lots of questions about virtual versus face-to-face. As Claire mentioned in her talk, our principle is that everything will be delivered virtually. And so I would assume that things are going to be delivered virtually. There may be one or two exceptions to that, which are still under discussion, but in the main, interviews and recruitment is going to be delivered virtually next year. Just sorry, I'm reading the chat frantically. Academic clinical fellow recruitment opening times. Claire or John, do you want to pick that one up?
Yes, I can do. They open in 1st of October. 1st of October for ACS, a month before specialty recruitment.
Thanks, John. Short and sweet. Excellent. I'm just rattling through. Possible to apply 33. So there's a question about applying for ST3 Group 2 specialties with an ARCP from intensive or internal medicine level 1. So as with any application to a program, when you're moving between programs, you won't have completed your core or IMT program when you put your application in for specialty. So by definition, you'll only have the evidence up until that point. So there is an acceptance that as long as you have an outcome 1 at that ARCP immediately preceding the recruitment round, that's acceptable. That's the nature of recruitment. So hopefully that answers the question. But if you need some clarification on that, please do put it back in the chat. There's a question about the specialty certificate examination counting for points on an application. Specialty certificate examinations are really designed to be a demonstration of completion of knowledge base towards the middle or end of specialty training, so are not part of the personal specification to enter specialty training. And so, as far as I'm aware, none of the medical specialties have included the specialty certificate examination in their application process. Pledge, just want to pick up the questions about the CREST forms, as there's a few of those coming through.
Yep, sure. So in terms of CREST, we've always committed that we wouldn't change the form unless we absolutely had to. So the last few years we've made various changes year on year. Now I'm pleased to say that this year we haven't had the pushback on the form we've had previously, so there's no need to change it. So therefore there isn't the CREST 2022 form, it will be the 2021 version. So if you've had the 2021 version completed previously, then you can use that for your application in 2022, providing that the post that you undertook to get that form signed off is within the 3.5 years prior to the start date. If it goes over that 3.5 years, then you will have to get another form completed, I'm afraid, for a different post. But providing it's been completed in 3.5 years and it's on the 2021 form, you can use that for 2022.
Thanks, Claire. There's a couple of questions about self-assessment scores, which I'll pick up. The first one is around around document uploads. If you're uploading documents, they should be tagged against the specific domain of the self-assessment form, therefore. So doing a bulk upload of everything you've ever done in your entire career doesn't actually help you. You have to tag them against the domains that are being self-assessed. And indeed, it makes the assessors' lives much easier if things are very clearly tagged and they have just the key documents that support what you're self-assessing. The second thing is about penalties. If a score is reduced on self-assessment verification, no, we wouldn't penalise an individual because their score had been reduced on verification. As a rider to that, if it was felt by an assessor that an individual was very, very highly overscoring themselves against the evidence they were producing to the level that it raised a probity concern, then we would have a look at that. But in general, the self-assessment is just to make sure that everyone has scored fairly in the process. Anything you want to add on that, on the self-assessment stuff? I think we've probably covered that off, haven't we?
Sorry, there is just one thing about someone's asked a question about what happens with the portfolio station interview that you used to have in face-to-face. Just to confirm, the self-assessment verification process replaces the portfolio station interview. But as Jeff has already said, you need to be careful on what evidence you upload. So some specialties might actually put restrictions on the number of pages or the number of pieces of evidence you can upload, because what you don't want to do is upload 100 pieces of evidence and then it not be reviewed properly by the assessor because there's too much, and the bit that is going to score the points is hidden in amongst a big pile of stuff. So be selective on what you upload. But yeah, it's the replacement of the portfolio station, basically.
Thanks, Claire. Thanks, Claire. Just a quick question about MSRA. The MSRA window will be opening in January and will be for 5-6 weeks.
It's normally about a 4-week window. We haven't had the actual dates confirmed yet, and I have just checked on the website. They haven't been released, but I know that we have secured enough seats for the MSRI sitting in, I think it's early January, mid-January it starts, but that will all be announced in the next couple of weeks as well.
Thanks. Thanks, Claire. And then as a question about IMT3 and going into higher spectrum training in ST4. Yes, so the IMT3 was created as part of Shape of Training to feed into the new four-year ST4 Group 1 specialties entry. So yes, for the Group 1 specialties, for an individual that's completed IMT3, they would in next year's recruitment then be going into a new curriculum ST4 post. So hopefully that covers that one off. ACF applications we've already answered, that's in October, as John said. Can you be offered a post at a later date if you're initially unsuccessful in obtaining a post? Well, that's just scrolled off the screen while I'm reading it, bear with me. So if others decline the post, or do you need to have something in order to be upgraded? So Claire, could you pick that up?
Yeah, sure. So offers will carry on being made throughout the recruitment process. So if you're not offered something initially, there is nothing to stop you being offered something at a later date as people decline, or if people hold and then get an offer from another specialist they'd rather accept. So the offers process is fluid. You don't have to have something in order to be upgraded to something else. You could have no offer and receive an offer at a later date. It all depends, as I mentioned in the presentation, around your preferences. So if you are just preferencing very, very popular areas and there are only a few posts available, then it might be that you don't get an offer initially. But if one of those posts becomes available at a later date and you are the highest ranked person who wants that post, you will get the offer for that. And after the upgrade deadline, there are no upgrades. So at that point, any posts that become available will go solely to people who haven't got an offer already.
Thanks, Claire. I'm going to start picking on John for a bit because I just realised I've been picking on Claire for the last few. John, there's a question about the capacity at the first recruitment round and what that means for re-advert rounds, but also whether we think there's going to be a large number of people who weren't successful last year who are waiting to be recruited this year. Do you want to pick some of that up?
Yes, sure. So I think we're expecting the similar applications for this round as we did in round one for 2021. There are a proportion of applicants who didn't apply, who weren't appointable last year. There is another round of recruitment for some specialties that will pick up some of those that were unsuccessful. So for posts starting in February, but we are imagining a similar round of recruitment, so around about, was it 16,000 to 20,000 applications this year. So it will be busy. We have looked to increase our capacity for interviews, but there is a limit on the number of people we can interview based on the number of jobs we have. There's no point interviewing lots of people if the number of jobs aren't there, because that's unfair on them. So look at competition ratios for last year. That will be your best indicator of competition ratios for this year, I would imagine.
Thanks, John. I would add that, as Claire alluded to in the presentation, the fill rates at round one and round two in this year were exceedingly high, and so we're moved into a slightly different area with recruitment. We used to see fill rates being significantly lower, but the increase in applicants means that we are filling programs. So overall, that probably does mean there's an increase in competition, at least for some programs. Picking up on questions about MSRI, MSRI will be sat in test centres rather than at home. We will have some capacity for those that, for personal health reasons, cannot travel, but the standard approach will be to use test centres as we've done in the past, and they are they're across the country. There's a question about a talk on ACF applications. We can certainly ask NIHR and the academic recruitment team to set up a webinar or a session, pardon me, for ACF applications. We'll take that away and ask them to set something up. I'm just flicking through. So timelines: adverts will appear on the 2nd of November, and applications will open on the 4th of November for IMT. There's a question about clinical fellow posts. HE, MDRS and Four Nations don't recruit clinical fellow posts. Those are recruited by individual providers, and so an individual provider can use any application form they like to appoint to their locally employed posts. So I'm afraid we're not going to be able to advise on that. Is it true that if I decline an offer, I'm not allowed to apply for this ever again in the future? You'll be pleased to know that's not true. We don't look back and see what you've applied for and then write your name down on a big wall if you've turned down a post. Each application is treated individually, and indeed up to a point anonymously, in order to try and avoid any prejudging or unconscious bias or even conscious bias creeping in. Do deaneries tell you before when they will release the offers? Claire, do you want to pick that up and just go through that?
Yeah, sure. So for each specialty, there will be a date by which offers are released initially. and you'll be aware of that from either the specialty specific guidance or the lead recruiter will inform you of when offers will start to be made. So you'll know what the first date is. Thereafter, it tends to be every 48 hours. So if they're released on a Monday, you can generally expect offers to then be released on the Wednesday and Friday of the same week, because as soon as the 48-hour offer window expires, the recycling happens. So any offers that are available are then offered to other people. So you'll know when the first date is, and you can basically work out where they're released thereafter. They're not released on a weekend, because the recruitment teams aren't at work, and the first iteration of offers will never be released on Friday. Just to mention as well, sorry, while I've just got the camera on me, the 48 hours does not include weekends. So if you get an offer on a Friday, so obviously not the first iteration, it could be the second, your offer won't expire until the Tuesday or Wednesday, because the Saturday and Sunday don't count in the 48 hours. So just to mention that, to be aware.
Thanks, Claire. It's clearly far too nice and understanding. Couple of other things coming through. There's a question about ACCS trainees switching parent specialty. That's a discussion you need to have with your head of school or TPD. It's not really a recruitment issue, that's a program management issue. So I would advise whoever raised that to pick that up. Then IMT for recruitment. I was not aware that we had an IMT 4-year. I certainly hope we haven't, because no one's thought about that yet. So no, there's not IMT. There's not an IMT 4-year to recruit to. From the point of view of ST3 and ST4 applications, so clearly the entry criteria and the scoring for ST3 and ST4 will have to be different. Those are for different specialties with different entry requirements, depending whether they're Group 1 or Group 2. So yes, it is likely that the application scoring will be different between the Group 1 and Group 2 medical specialties, because if you're in a Group 1, if you're applying for a Group 1 specialty, you will have done 3 years of IMT, whereas if you're in a Group 2, you'll only need to have done 2 years. So that will be different. So apologies if my answer about applying for different specialties was unclear. There is no disadvantage to applying for different specialties. So each specialty only sees your application to that specialty. They don't see any other application you've made. But what you will need to do is make sure that you've carefully looked through the personal specifications for each specialty that you apply for, because they may well be different, and make sure that you meet those. And in your specialty application, make sure that you justified why you want to do that specialty. So as John House has put in the chat, don't apply for surgery saying you want to be a psychiatrist. It wouldn't do the surgeons any harm to have a few people who think about mental health conditions in their teams, but possibly not the best recruitment approach. And although we shouldn't really use anecdotes, I will tell you about a trauma and orthopedics application that I got asked to review, and the reasons for applying were, and I quote, "My dad was a trauma and orthopedic surgeon," unquote. That didn't score quite so well in the application for specialty, and hopefully that gives me a chance to catch up. F2 standalone trainee getting FPCC signed off in August 2022. Am I still eligible to apply this year? So my understanding, and I'm waiting for anyone to shake their head at me, my understanding is absolutely you can, on the same basis. We can't expect you to wait until you've finished a program and then wait another year before going into the next program. So we do allow you to do that, yes. List of evidence required, that will be released prior to each recruitment window, and will vary by specialty. So I don't think I can go through all of them this evening, but we'll make sure that you have all of that information ahead of time as part of the personal specifications. Applying as a less than full-time trainee, do you apply as a full-time trainee and then have to reapply to train less than full-time, and do you have to re-evidence? To stop me talking anymore, Claire, do you want to pick that up?
Yep, sure. So on your application form, you'll need to say that you want to train less than full-time. What you normally have to do is get an eligibility letter from your current region at the time of application to say that you are eligible for less than full-time training. If you are offered a post, you are then offered a full-time post, and you then have to make an application for less than full-time training in the region where you receive your offer.
Thanks, Claire. We're getting a few repeat questions coming through, which I think we've covered off, so it may be that we will point people towards the recording of this rather than giving the same answers several times. Will all scoring domains be included this time as compared to a few chosen last time? So yes, our expectation is that each individual specialty will, as part of the self-assessment process, release the self-assessment form and the domains that are being scored. From the point of view of individual interview patterns, I'm not going to go into detail by specialty on that. We'll be releasing all of that closer to the advert time. Is self-assessment different in each specialty? So the quick answer is yes. The slightly longer answer is that it tends to run in sort of specialty groupings. So self-assessment forms for medical specialties will all look very, very similar. There may be some subtle differences between specialties, but in the main, medical specialties will have a common style of self-assessment form and questions. And showing portfolio at digital interview, so the evidence portal will be used as the mainstay of looking at evidence, rather than you having to find a way of holding bits of paper up to the screen. That's correct, isn't it, Claire? Yeah, getting a nod on that. So there's a question about having time to apply, sit, MSRI, submit evidence self-assessment. We have brought the whole application and recruitment process forward again this year. So we did this last year as well, in order to give both you and our teams a little bit longer to get everybody through the recruitment process in a fair way. We are taking that into account. Clearly, we have to balance that a little bit against you actually having had a chance to build a portfolio of evidence if we move the application window earlier. But we feel it's the fairest way of doing it is to do so. So we'll make sure that there's time. And there's a few questions which are specialty specific, which again we direct you back to the individual recruitment officers about, but we'll be releasing that as we go into the recruitment round. Has any of the group picked up any more general questions that aren't specialty specific? Yes, Claire?
There's quite a few questions coming in about the MSRI and when you can sit that and whether you have to wait until you've been longlisted or whether you can choose a time. What will happen is you will apply in December for your specialty. All longlisting process will be completed before Christmas, and the names of everybody who needs to sit the MSRI will be forwarded to one team who manage all of the bookings. You will then get an email that tells you how to book on. So you'll get login details, I think, to the Pearson View website, and you'll be able to book your MSRI from that date. So you don't bother making contact before, or don't try and sit it before. You'll get contacted with details of how to do that, and you'll have to sit it within, I think it's a 4-week window in January. So that answers those questions. There's also something about whether you can just sit it once, I think I saw somewhere. So you only need to sit it once. You can carry scores over from one round to the next within the same recruitment year, or if you apply again in the subsequent round and want to try and improve your score, you can also sit the MSRI again if you choose to do so.
Thanks, Claire. A question about applying for a Group 2 specialty if you've got a 10.1 outcome at your ARCP. So for clarity, the 10.1 outcome recognises that your training has been impacted upon due to working during the pandemic, either due to redeployment or just because you haven't been able to gain certain areas of practice. But it very clearly says that although there are areas of your training you need to catch up, you don't need an extension to do that. That means that you can apply for specialty training with a 10.1. You will have to demonstrate, you will have had to complete training and get an outcome 6 for your IMT 2 program. By the time you start that next point, putting aside there are some derogations that have been agreed with the College of Physicians, and they're up on the JRCPTP website. But yes, you can put in an application if you're holding a 10.1. It's the same as having an outcome 1 at ARCP as you go into an application. From the point of view of care of the elderly rotations, doing a care of the elderly rotation is a requirement for internal medicine training now. So all IMT programs should include a care of the elderly geriatrics rotation, and that's an expected requirement for that program. And scrolling down. Claire, I'm just the answer you just put in the chat about appointments take place at CT1, ST1 level. Which question did that relate to? Because I've lost.
So there was a question from somebody saying that they're an existing core surgical trainee wishing to apply for a run-through specialty. Would they need to start from scratch if already successful and completed a year in CST? Or all specialties either advertise at CT1, ST1 level or ST3, ST4. There's very little recruitment at CT2, ST2 level. So yes, you would have to apply again. If you weren't eligible to apply at ST3 level, you would have to apply at ST1 and then seek accreditation for transferable competencies once you're in post through discussion with your local programme director and the GMC. But certainly there would not be recruitment at ST2 level, so you couldn't be recruited directly into that year of training.
Thanks, Claire. So to the individual who's heard rumours that some smaller specialties blacklist people who rejected offers, it's an absolute myth. It can't happen. The applications are anonymised, and even for smaller specialties, it just couldn't happen. We are getting close to running out of time. We have a very significant number of questions still coming in. I think up to about 45. I think the reality is that we're not going to be able to answer all of them in the next minute or so. So we will go through the questions and put some and use that to generate answers that we'll put up onto the specialty recruitment websites and make sure you've got access to it. But as I say, summarise a couple of key things. For specialty specific recruitment, the personal specifications and the selection criteria, so what's going to be on a self-assessment form, how the interview is going to be run and so on, will be available to you imminently. We're absolutely planning to make sure that that those are available to you before you put in an application and throughout the application window. We are dependent on the individual colleges and recruitment teams pulling those together, but they've been given a very clear deadline. It is likely that there will be differences to last year's recruitment. We've learned stuff from last year's recruitment in all specialties, and we're always attempting to improve and make recruitment fairer year on year. So recruitment, there will be some subtle changes from what we've learned from previous years, but I'd advise you to keep an eye on the specialty recruitment website and on JCST and JRCPTB and the other specialty recruitment offices, as that information will be appearing as quickly as possible. All I would say is now a massive thank you to the MDRS team for fielding all the questions and providing me with the answers. Thank you to Claire for showcasing what's going on this year, and the backroom team keeping this running smoothly. Many thanks for your attention this evening. Good luck in all of your applications for recruitment in 2022, and I hope you have a good evening. Thanks very much indeed.